Two.
Welcome to the Capitalist Sage Podcast. We're here to bring you advice and tips from seasoned pros and experts to help you improve your business. I'm Karl Barham with Transworld Business Advisors, and my co-host is Rico Figliolini with Mighty Rockets Digital Marketing, and he is the publisher of Peachtree magazine. Hey, Rico.
Hey, Karl. Great to be here. We might as well jump right into it, and I'll tell you about our lead sponsor for the show and for the family of podcasts. And that lead sponsor is Parkway Fiber. They're a large Southeast company involved in fiber optic cable and internet connectivity. Don't think of the cable guy because they're not that. They're a company that's right in the communities that they serve and providing a variety of services, including that connectivity to your team that's out in the field, teleworking. They provide it whether you're a small business or you're an enterprise-sized business. They provide tools like Smart Office that can keep your team working both whether they're in office or they're out there at home, wherever they are working for you and getting sales done and getting work done. So check them out, hargrayfiber.com or hargray.com/business, and find out how you can get your $1,000 gift card, Visa gift card, from them once you get involved with the company. So we want to thank them for being our sponsor.
It's funny how so many people are operating from home,
Yes.
learning from home, and so having great internet and fiber optics is super critical. So thank you for Hargrave Fiber for supporting us. Today, I'm honored to have Dr. April Hang, who is the owner of Peachtree Pharmacy right here in Peachtree Corners in Gwinnett County, Georgia. We're going to continue on our series talking to small business owners about navigating through 2020, the pandemic, and all the things that have been happening in our community. Dr. Hang, how are you doing today?
I'm good. Thank you for having me on the show. I appreciate and feel honored to be here with you.
Well, I'm just happy to have you, and the fact that you're in the medical health field, operating a business here is really important considering what this year has been like. But why don't you start off by introducing, tell us a little bit about yourself and why did you get into pharmacy for a career?
Well, I worked at CVS as a high school student, and I saw the pharmacists, and it intrigued me to see these crazy names and what they treat. So I just kept wanting to learn more. Then I got into pharmacy school at Virginia Commonwealth University and graduated in 2002. We moved to Atlanta in 2009 when my second child was born, and I continued working for CVS. And when I was pregnant with my third child in 2011, that's when I said, okay, I'm just going to open my own business because I'm just tired of all the red tape.
I can imagine. So many people go through that same journey in opening their business. What made you choose this area to open it, and what do you find that you like most about being your own business owner?
I actually got into business so I can have more time for the kids and more flexibility. So I wanted to be able to have a stable income and have the flexibility to be there for the kids. So it's, I knew initially it was going to be more time consuming, but then, as time passes, it's a lot better now. So.
Yeah. No, I appreciate that. Are your kids here locally? How many kids do you have?
I have 3 children.
Very good. Well, it's so important to be part of the community that you're in. So you're operating, you live in the community as part of that.
Right.
Often people aren't as familiar with some of the independent pharmacies. I wonder if you could share with us some of the things that make your pharmacy different than some of the chains like CVS, Walgreens, and others.
We compound at Peachtree Pharmacy, which is the biggest difference, which is making customized medications for you or your pets or animals that you have. A lot of the compounding we do right now is hormone replacement therapy and vet meds. So that's one main difference. We also do blister packaging, which I'm sure you guys have heard that PillPack was bought by Amazon and they're trying to do blister packaging. We do that for local patients. And that way, we can manage and keep that close relationship as if they're family, make sure everything's okay, or put in the right time position of their blister packs. So I don't know if you're familiar with what I'm talking about.
No, I am a little bit, but it'd be interesting. Have you seen more need recently for being able to provide that more customized service to your customers?
It really depends on where they're living. If they're in a personal care home, then it's mandatory that they get blister packaging. If you're still living at home, it's a personal choice to have that convenience, so you're not filling your medicine tray yourself. So that's an advantage that we have.
Oh, excellent. Well, I'm curious to ask you a little bit about this year, and when the news of the pandemic started coming out. When did you first hear about it, and did you think it was going to have an impact on your business initially?
I actually, it did have an impact as far as PPP goes at the beginning. We had a program where it would upload things onto Google saying we had certain things like N95 masks. So we had a lot of questions about N95 masks and hand sanitizers and things like that initially. We also have increased deliveries now since the COVID, and then patients are asking me to go outside and give them their flu shots in their cars so they don't have to come in and interact with people.
So, since this all started, your business was considered an essential service? Did you close
Yes.
down at any point during?
We did not. We just put procedures in place, started requiring masks, just following the CDC guidelines. There were people that embraced it, and there are, of course, people that are not embracing it, or they're against wearing masks.
So now that it's kind of normalized to some degree, if you want to call it that, are there changes you've made in your business that, because of this, that you've implemented that's had an impact either on your employees or your customers?
I don't really feel like that it's been impacted much. I mean, we did, like I said, put up the plexiglass and made social distancing and one entrance and one exit. But as far as the business go, it's been pretty stable. You know, depending on what's coming out in the news about COVID, sometimes they would say something about azithromycin, so then all of a sudden there'll be a back order of that because it was in the news, or Plaquenil. Just certain things, whatever the news says, then all the physicians, they try to write for themselves, write for their families, and we have to say you can't do that.
So I'm curious. Go ahead, Rico.
I was going to ask, as far as supply chain goes, were you finding yourself in need of certain medicines or short supply of certain things besides the masks and stuff like that?
I know there was a shortage on Plaquenil for a while, and the azithromycin, because that's the main two things they're using to treat in the hospitals. But I think it's normalized now.
So
But we can compound it. I do have the powder where we can actually make the Plaquenil in capsules.
But so
for
as far
those that
as
may not know, I was just going to ask, for those what are those used for? What are treatments for?
Azithromycin is an antibiotic, and then the Plaquenil is for like autoimmune, usually like lupus type, and lupus type of inflammations, autoimmune diseases.
So most medications, most prescriptions that have been coming to you, though, you've been able to fill and all that. Pain medications, other things along those lines.
Right. Yes.
So I'm curious, as you follow what's happening with vaccines and some of the treatments and therapies coming out, how do you prepare your pharmacy for anticipated demand when different drugs are, getting approved or being? How do you manage that process? what information and sources do you use to know what you need to have in stock?
We, we just follow the CDC guidelines. So whatever comes out, we try to follow that. As far as like sources of medications or vaccines, everything is pending. So there's nothing really credible out there. So I can't really comment on it.
Got it. Testing. Do you get involved much with testing that they've been talking about?
We do not test at the pharmacy. There's a little bit of fear with the staff, so we don't test. They have small babies and families, or their parents live with them, so they have their personal concerns. So I don't enforce it, but I just make sure they let the patients know where they can go and get access. I know that I have a contact that can come out. They have a mobile bus, and they'll do both the nasal swab and the serology test. And the difference is one tells you you have it, and one tells you you had it.
Got it.
So antibodies you're talking about, or is that something
Right.
different? Okay.
Correct.
And there's a bus that does that here in Peachtree Corners even?
Well, I'm trying to get them to come out on 10-3, the mobile bus. It's actually with Dr. Heavenly Kimes and her husband, Dr. Damon Kimes.
Sure, they're local, I think. Right?
So, and yeah, they are local, and they're reality TV people as well.
Yes, we are in a reality show ourselves, right?
Right.
This whole year feels like it's been part of a reality show. So,
Right.
For young people out there that are thinking about businesses and careers to go in, what are some of the reasons people might go into pharmacy, either owning or becoming a pharmacist?
There's so many different parts to the industry that people don't know about. There's working for pharmacy manufacturers, and you can be a medical science liaison between the public or the hospitals and the pharmaceutical company. There's PBMs, pharmacy benefit management organizations that handle your insurance and tell you what they're going to pay for or not pay for. You can work for those companies. You can work for wholesalers as pharmacists. The hospital, obviously, different areas of the hospital. And then there's something called closed door pharmacy, where they do blister packaging just for senior facilities. So there's a lot of different avenues.
What's a good way for folks to get started? If I was a young person, or if you were advising younger folks, high school, college, what are some things they can do to start getting experience to see if it's the right fit for them?
I know personally, for me, we have students come in and ask to volunteer, but there are some state regulations where you have to be minimum age of 18 to actually be in the pharmacy. You have to register with the state just to be a pharmacy technician. And once you're registered, then you can come behind the counter and kind of shadow and learn. I would just recommend finding a local independent pharmacy that would take you as a student or as a shadow.
Oh. How is the prospect in the industry? Is there a shortage? Is there excess? When you're trying to find people, has it been difficult?
It's actually an excess in pharmacists at this time. So, jobs are a little bit harder to find. People are graduating, and then the salaries are going down because of the abundance of pharmacy schools letting out students.
What do you think drove that? Is driving that?
Well, and when I went to pharmacy school, there was a shortage.
Yeah.
So as time went on, more schools opened up, and they started producing more students, and now it's just an overabundance of pharmacists.
Do you think that if someone wanted to get into the business, right, the pharmacy business, it's intensive, I'm sure, investment to get into it, besides you need someone that's licensed to do it.
Right.
Does it have to be owner licensed to be able to get into this business?
No.
Okay.
You don't have to be a pharmacist to be an owner of a pharmacy.
Okay.
Oh.
And Peachtree Pharmacy has been around for, how long has it been now? Several.
It's been 6 years now since I
6
opened the
years.
store.
Okay. Yeah, I remember we used to go to CVS, and
Right.
there was some issues about getting how CVS handles certain types of medications and inventory. Unlike
Right.
retail, they do not track their inventory, so and they can't even let you know you have it. They have certain things unless you come into the store to ask them. So
Right.
this is one reason we decided to come to Peachtree Pharmacy, because it's just we felt that we were talking to someone closer, more
Right.
consistent, and it was just a better experience. No drive-through, but that's okay, especially
Right.
if you have to be aggravated with
Well, we
family
come
members.
outside, and
Yeah,
even though we
yeah.
don't have a
Do you have?
drive-through,
Yes.
I've been outside to bring people their
This
prescriptions.
is true, and you guys deliver too, I think, is what I
Yes,
understand.
yes. And usually, like if it's a parent and their child is sleeping in the back, they'll say, "Can you bring my medicine outside?" Like, of course, no problem. So,
Well, what's something about the business of pharmacy that most people wouldn't realize about it? Is there anything that you think might be surprising to folks?
I think that the amount of time we actually spend on the phone with the insurances trying to get you your medicine is the most challenging thing, because just because a physician writes for something doesn't mean your insurance is going to pay for it. So then that becomes the issue. It could be 2-3 days before you get your medication. If you're just coming out the hospital, you might rebound and go back into the hospital because you don't have your medication. So it's just insurance is making everybody's life hell, basically.
Yeah, yeah,
It's
and
true.
some of them will cover the generic but not the brand, right? And some of them,
Right,
and some people want the brand versus the generic because they feel maybe the brand works better, right?
right.
Is there a
Mm.
difference
But
for
you're
you?
not allowed to have that choice with insurances.
No, you're
Yeah.
not. No, they tell you what to take.
So you managed to keep track of. So now that 2020 is kind of continuing, I'm curious about looking toward the future. Do you see things that you can do differently, or as you go into the future with your business?
I've learned since I guess a couple years ago, I had a senior come in my store. This is somebody's grandmother, somebody's aunt, sister, cousin, you know, and she handed me a prescription for medical marijuana, and it said a ratio of 1 to 30, and it said one dropper at bedtime for dementia, and I didn't know how to help her, and I felt so bad when I can't help someone. I feel really awful. So she got on the phone, put her son on the phone who was in California, and he was really upset. He's like, "Where can I send her to get this? She really needs it. It helps her stay at home by herself. It helps her with her daily activities, or activities of daily living, and things like that." And I was like, all I could do is apologize and say, I don't have an answer for you, because we're in the Bible Belt. You're out in California. It's different. It's different here.
Mm. So what are you able to provide CBD or medical marijuana here in Georgia?
Medical marijuana is not accessible. CBD is very accessible anywhere. You can get it from gas stations to the smoke shops, and Peachtree Pharmacy. So, but it's you have to educate yourself. You have to understand what the effects are. It can interact with your medications. You know, depending on how much you use, there's the risk of having a positive drug test. So it's just you have to be able to educate your patients on the proper use.
Where would folks go to learn more about that? Like, just get educated on some of the benefits, what treatments for that. Is that a conversation with the physician? Are there online sources for information?
Honestly, I am on this thing right now where I want to educate other care professionals about it, because most of them don't really know. I mean, there's so much out there There's a DNA test you can do to let you know what ratio is best for what condition. So they have that for, general big pharma medications, but they also have it for the CBD and THC as well.
So
So
does a doctor have to write a script for that, or is that something people can come in and get without a prescription from a doctor?
they can come in and get it at Peachtree Pharmacy. It's just it's actually a cheek swab, and it's from a company called Indocana out in California, Los Angeles. And so I kind of met them at a conference and kind of partnered up, because I wanted to be able to offer the full spectrum kind of service for all the patients, not just, big pharma meds, but offer, all the benefits of CBD that's emerging on the market now.
In April,
Now,
you've been involved with some of the politicians in the area, I think, too, right?
Yes.
Lobbying,
Yes.
some legislative work. So who have you been working with, and how is that going?
I actually am not officially a lobbyist. I'm officially a constituent. So when I go there, I'm going for me personally as a pharmacist and not representing any company, but you know, the intentions I have to help people. So when they were talking about access to medical marijuana, I did speak and say, you have to have pharmacists involved, make sure that they review everybody's meds because there are drug interactions. And, they don't teach you that in pharmacy school. All the knowledge I have is stuff I've read, just learned about.
Really, they don't teach you about
They don't
interaction with
teach you
drugs
about
and stuff.
marijuana in pharmacy
Ah,
school.
okay, okay.
not
Unless
in the
it's,
classroom.
I was going to say maybe in the dorms or something. Yeah.
So what types of treatments or things that people are coming in for CBD and similar?
I mean, we have like the CBD oil. I don't know if you can see that
Is that peach
CBD oil.
relief or something?
Yes, it's peach relief.
Okay.
CBD oil that we sell. We have capsules, we have topicals, we have dog treats, and soon to come we'll have gift goodies products in the store.
Dog
What
treats?
types of conditions does it help with? What types of patients would might find this helpful?
Um, Honestly, any patient who have headaches, depression, anxiety, sleep deprivation, anything. So,
And you said you do that DNA.
pain.
You what? The pain, right? You say you do that DNA swab, and that's supposed to
Right.
help with that ratio of medicine that you're able to apply, right? PCB on.
Right. So if in the perfect world, or where I see the future going, is that when you'll have this DNA test, and then you have more customized medication, um, that works for you based off of your genetics. So you know what your body can process and not process. Because if you don't have the enzymes to get rid of the drug in your body, then
Mm.
that drug can kill you. So, you know, it's a, it is a beneficial test. It's just DNA tests are very expensive. So,
Yeah, I don't think most
med-
people realize that. Yeah, most people, if I'm not incorrect, don't realize that medicine, even antibiotics or mainstream medicine that people hear about, only
right.
work on a percentage of people. They're not, people assume that they're 100% effective, but no medicine is that way, and they're usually probably only 80% effective in
Right.
patients, right? So
And your
that
body
DNA,
can only absorb so much. So, like on CBD oil, if you consume any kind of CBD product, you only absorb 6%. And I don't know where I read that, but that number is in my head.
Does it matter, like, proportionate to the size of the person, or is it just their genetics in there?
It's their genetics. Like you have in your body what they call the endocannabinoid system, and so you have CB1 receptors and CB2 receptors. So CB1 receptors is your central nervous system, and that's where the THC usually binds, and that's why you have the psychoactive effects. However, with the CB2 receptors, that's more on the peripheral, the body, and the organs. So if you have some kind of inflammation, it'll help you kind of get back to normal or get to homeostasis.
Wow. Well, I know there's been a lot of different folks that are providing that. You mentioned gas stations and so on. And
Right.
do you know if they're doing anything to kind of gain greater control? Because there could be contamination. There could be, you don't know
Correct.
Right.
what the source is some of
Right.
the risks that I've heard about. Can you tell me a little bit about some of the risk factors of procuring it in the wrong place?
Well, there's a lot of mislabeling. I know, like if you have a CBD product and you're not sure that it says what it says on the bottle, you can actually send it to Georgia Extracts, and they'll test it at UGA in Athens, and let you know if it's really what's inside. If that makes sense.
So, because this is not prescribed or anything, there's no FDA approvals, there's no Georgia
No,
State quality control of it, whatever's sold
no.
in the state. Right.
There is the Farm Bill, and that's just with the hemp flower. But I honestly haven't read the entire Farm Bill, so I couldn't comment too much on it. But I know it's to help regulate the actual growing and agriculture, like keeping pesticides out of it,
Right.
um,
So
and making sure it's organic.
do you see, April? Do you see whether if pot if marijuana becomes legal in the state of Georgia, at least medicinally legal, if not
Hmm.
recreationally legal, do you see that as something that Peachtree Farm would be selling, that alongside the the CBD oil and stuff?
It's actually in the bill HB 324, that when the state gets the infrastructure set up, it'll be sold at certain specific pharmacies, and how they decide that will happen after they set up the infrastructure for access.
Right.
So,
So
so
certain. So every pharmacy or just certain pharmacies?
just certain. My understanding is going to be certain pharmacies. So they're right now they just hired an executive director to create the infrastructure for the low THC oil.
Mm-hmm.
And so once that is set up and people start applying, then they start growing. While they're doing the cultivating, they're going to decide. The board of pharmacy is going to decide. Okay, which pharmacies will be allowed to carry these.
Okay.
Yeah. I mean,
So
as
that's
you
all.
Yeah.
if you
Yeah.
look
It's
into the
good.
future,
Yeah.
how big can that industry you think get? How um, I hear a lot of different ideas around how widespread people might use it for all the different applications. But
Right.
have you thought about how big that could be and how it might impact your business?
Honestly, it would help people get off their medications. So, I mean, if people would learn a little more about it, they can probably reduce their medications.
Oh, okay.
But they have to make sure, their doctor knows, the doctor's educated, or the pharmacist is educated, or the nurse.
Well, I know. As we look into the near future, um, people are being impacted because kids being home and everything else. Um, how are you balancing all the demands on you, business, your family? Have you figured out things to help you manage through this
I
crazy year?
mean, I'm lucky and I have a supportive family. I have my parents living with me, and then my husband is very supportive. So, I've been lucky. I've been able to, you know, go back and forth and stay home if I need to. So um, I'm just home more. I miss
Yeah,
going to the movies.
yeah, I think we all do. Although I hear that they're starting to open up in some locations,
Yeah.
and getting back. But between that, sports being thrown off schedule, um, I don't know what part of the year we're in sometimes based on all of that. But good. Well, I want to
Right,
thank you so
right.
much for joining and talking a little bit about the impacts of the pandemic on your business. Help educate us a little bit about
Mm-hmm.
CBD oil and some of the alternatives. that are available. And more than anything, I consider you and your staff frontline first responders. People needed help, and through this year, they need to get their medications, and it's small business owners like yourself that have done just a great job of keeping people well as best they can. So, if you haven't been thought, once thanked you from one of your clients, I'd like to do that for them.
Yeah.
Thank you. So,
Well, how would folks reach out? Why don't you tell us your address and how they can find you, social media, phone number, just if they want to reach out and learn more.
our phone number is 678-691-9079. Our website is www.peachtreerx.com. We're also on Facebook under Peachtree Pharmacy and also Instagram under Peachtree Pharmacy.
And what's your address and where would we find you here in Peachtree Corners?
It's 5270 Peachtree Parkway, where the new Vital that just opened up in that shopping center.
Well, absolutely. Well, we definitely encourage folks to take a visit, meet Dr. Hang and her staff, and just want to thank you again for being on our show today.
Thank you. I appreciate it.
You're welcome. And stay safe, please.
Yeah.
Well, I'd like to just segue into what we have coming up. We've got more of discussions as we talk about the end of 2020. We're going to have some podcasts talking about, what do you do now as you're getting to the end of the year to grow your business. And so stay tuned. Follow us on all of our different channels. I'm Karl Barham with Transworld Business Advisors of Atlanta Peachtree. Both myself and the rest of the folks on my team, we help talk to business owners, help them figure out how to improve and grow their business, whether it's through acquisition or for those that are ready to do something else, how to exit their business. Feel free to reach out to us online, www.tworld.com at Atlanta Peachtree, /Atlanta Peachtree, or you can email me at kbarm@tworld.com. Rico, why don't you tell us about what you have coming up?
Sure. We're working on the next issue of Peachtree Corners magazine. We got a strong set of stories, hopefully, coming in there. We're actually doing a pet and their people issue as well. So we have a giveaway that just started running today. And 3 winners, $700 in prizes. Submit you a picture of yourself and your pet, and it will probably get into Peachtree Corners magazine's next pullout, next issue. Plus, we're doing a story about backyard retreats. Everyone's home. They're doing COVID-19. So if you have a fire pit, you have a beautiful backyard, we're checking out 5 of them in Peachtree Corners. We'll share where those are and what they look like. And we're asking 50 people, almost. We're asking everyone, actually, and hopefully we'll get 50 of them, about what they're thankful for this year. Besides, we're thankful for family and friends for sure, but what else are we thankful for during these times? So we want to find that out. Remember, this is the October-November issue, so we're doing Halloween and Thanksgiving in that same issue. Yeah, so it'll be fun. So we're working on that. So if you guys want to check out the last issue, which April was part of that last issue, she was one of several people we profiled when it came to diversity in our community. You can find that online at livinginpeachtreecorners.com. Follow us on Peachtree Corners Life, the Facebook page where we're doing these podcasts from. Our YouTube channel, you should subscribe to that as well, because this way you can get alerts when we go live there and when there's more videos posted there as well. And I do work with a lot of different companies handling their social media, video production, whether it's product videos or other types of production work, and obviously producing podcasts as well. So you can check me out at mightyrockets.com for that, or find me on LinkedIn, or Google my name, because there aren't that many people called Rico Figliolini. So you can find me anywhere.
Well, thank you for all that you do, and please do check out the magazine online. There might be some still out there to pick up if you haven't, and just keep up what's going on in the community and get to meet and learn the folks that make up your community. Thank you again, Dr. Hang, for joining us today. Everyone
Thank you
have a
for
great
having me.
day.
I appreciate it.
Thank you.